We've been talking about this next topic for a while now, spring allergies.
They are bad right now, have you noticed? So we wanted to dig a little deeper into finding some more relief. So we have Allina Health Doctor Pramod Kelkar with us today. Welcome.
Thank you.
We were racking your brain a little bit during the commercial break because we both suffer from spring allergies too. What are some of your favorite kind of over-the-counter remedies for people who are suffering right now?
You know, good news is there are a lot of medications that used to be prescription. They are available as over-the-counter medications now. Antihistamines like Claritin, Zyrtec, Allegra, and nasal sprays like Flonase, Nasocort, all of them are over-the-counter now.
So those are some of the remedies. Are there certain types of allergies that we're experiencing right now? I imagine it has to do with what's blooming on the trees and in the ground.
Yes, absolutely. Right now, tree pollens and mold allergy, those are the two biggest allergies. Springtime is big for tree pollens, summertime is for grass pollen, and fall is for ragweed.
Okay, so the mold, is it like a snow mold or?
Some people call it snow mold. Anytime you're going to get wet area, the wet area attracts mold and mold growth. So it's common in springtime as well as in fall time. Like when people are raking leaves, they need to be careful because there will be high mold count.
And this morning I had some old dead leaves I was moving around and they were wet, and I was thinking about, do I need to take extra today? That brings me to something I've thought of. I'll start with a nasal spray. Sometimes I'll take a pill as well. I find myself compounding different medicines. To what extent can we do that? Can you have an Allegra and a Zyrtec in the same day and a Flonase? Is there a point when it's too much medicine in one day?
Yes, there is a point like that, but it is okay to take Allegra or Zyrtec and Flonase together. I like to recommend patients sinus rinse or Neti-Pot because that will be very effective in cleaning up the allergens, the pollens from the sinus area. And I recommend that people try it once a day, especially once they finish their outdoor activity. When they come home, they can flush out the nose and sinus.
I remember you told me about that on a story I was doing last year, and it felt like a lot to people at home, like do a Neti-Pot every day, but you're saying every day.
It's like brushing teeth. You know, it keeps the sinus area clean. And if you keep the area clean, then you're going to be better with less medicine. Of course, if the medicines are not working, that's when people like us come into picture, and then we can do the allergy testing and additional allergy treatments.
What does that testing look like for someone that feels as though they've gone to every part of the counter at the pharmacy? You know, what are you able to determine with a doctor visit?
Well, the first thing we do in allergy clinic is we determine what things you're allergic to. So we will test you for a bunch of allergens like dust mite, cat, dog, mold allergy, tree pollens, grass pollens, ragweed, fall weeds. And then depending on what allergies you have, we can tailor the treatment. For example, one of the common treatments that people know about is allergy immunotherapy or allergy shots. But that has to be individualized based on what allergies you specifically have.
Yeah, a little more tailored. I know I've heard you say this in the past. You have to enjoy spring and get outside too. So that's important.
Yes, I always tell my patients and tell your viewers too, nobody should deny themselves the pleasure of outdoors, especially in Minnesota when our warmer season is so short. And we have so many great medications, prescription as well as over-the-counter available now, that we can control the allergies very effectively.
That's right. There's a lot of options out there, and then if it reaches a point where you need to see a doctor, you know, don't deny yourself that opportunity. We need to get outside.
All right. Thank you so much, Dr. Kelkar.
Thank you so much.
As always.